We are live.
Sure. Good evening, everyone. It's another evening at 8 p.m. and we are here with another Gyan Pravah series, podcast series, a brainchild of our president, Dr. Sunita Tandulwadkar, ma'am. Today is the episode 203, and every day at 8 p.m., this podcast keeps happening, inspiring us, teaching us a lot of things, and we learn a lot from this wonderful series that has been initiated by Sunita, ma'am. She makes it a point to be present in most of the podcasts, but today, unfortunately, she's not here. But of course, we have our beloved Dr. Ashwini with us today. And she, being the joint secretary and being, I would say, an apt replacement for ma'am, is here today, but also, of course, in her own rights as being the joint secretary of Fogsi. Plus, of course, it's a pleasure to have her in a program because she's a very dear friend of mine as well. So Ashwini is here, and today we have with us Dr. Mangalavani ma'am, who's a guest speaker. She is the president of the Breastfeeding Promoters Network of India. And this being the Breastfeeding Awareness Month, it's a pleasure to have ma'am with us. And we are so happy that ma'am has gracefully accepted our invitation as well. So I would now like to invite our dear Ashwini, Joint Secretary Foxy, embryologist, a consultant fertility specialist practicing in Asha Kiran Hospital in Pune, to kindly say a few words about the podcast series and also welcome all our delegates and faculty present here.
Thank you so much, Priyankur, for the kind introduction. A warm welcome to Mangala Madam. Who better guest would you get for this Breastfeeding Awareness Month than Mangala Madam herself? We have seen her work so relentlessly for the cause since many, many years. Not even, that time, not many people were really aware about this, and there were not many programs happening like they happen now. For the past 15 years, I've seen Madam doing this so meticulously, and I myself have done a lot of programs with Madam in POGS. And every year, Madam makes it a point to conduct these awareness activity at all the 5 medical colleges. All the 5 days, Madam is super busy with all this. Only at times when she is in UK, probably she must be missing it. But otherwise, she's worked very hard for this. And Mangala Madam, I'd like to tell you that these are the podcast series which happen every day at 8 p.m. And we have different guests from all the fields, academic, social, political fields. And this is a brainchild of Sunita Madam, where all the 30 chairpersons at all 30 days interview various people. And just last month, we finished our Kashmir to Kanyakumari Yatra of breast cancer awareness, which was headed by Dr. Charu Madam. So it was also a very wonderful initiative, and we are working very actively for cancer awareness through our program and the brainchild program of Madam is a Sampurna, which is a preconception care. I would also like you to get involved in this preconception care Sampurna. So it is a wonderful initiative for comprehensive women's health care. And now we are looking ahead to carry on this program for the next 3 years. And wishing you all the best, Priyankur, for this podcast. And thank you once again, Mangala Madam, for joining us. I will join in from the viewers link. Yeah.
Can I say a few words?
Thank you, Madam.
Sure,
Bye,
Mangala. Ashwini, I think Mangala ma'am wants to say something.
Yeah, Madam.
Yes.
Yeah.
So first of all,
Yes,
thank you so much to Sunita Madam, President Foxy, and Priyankur and Ashwini, and I feel a great honor to be here. And I'm so happy the Foxy has taken this in a big way. The breastfeeding, which, as you said, was a neglected subject before. And there is so much awareness. And I see Sunita working so hard, and she is like a role model. She works hard herself, and then she takes the team along with her. And I can see all the committee chairpersons working so hard, and particularly in this August, everybody's geared up, and I'm very happy about it. So thank you so much, Ashwini. And we have worked together so many times. And I'm particularly work more in the area of breastfeeding. So I'm very happy to be here. I'm very glad. Thank you.
Thank you so much, Mangalavani ma'am. Ashwini, thank you for joining us. It's a pleasure always to have you, to listen to you.
One of the pioneers to bring this particular subject-headed conference in Pune. To have a 2-day festival in this, and it has become so famous in Pune that every year everybody looks forward for those 2 days celebration of specific breastfeeding and a lactation conference. Now they're having the same conference next week in Lonavala. So all the
Awesome.
best, madam, for that conference as well.
Thank you so
Thank
much.
you so much once again. Bye.
Thank you, Ashwini. So now I would like to once again formally introduce our guest speaker today, Dr. Mangala Vani ma'am. She is the first IBCLC in India. She is the first one in Foxy to start breastfeeding conference called Lactagon that is done with POGs that Ashwini just talked about. And she has been doing it every year since 2015. The first batch of IBCLC training from BPNI Maharashtra was conducted by her. She is the first gynecologist to start specialized breastfeeding clinic in Pune, and she is the first one to start mother to mother support group in India. So Dr. Vani ma'am, thank you so much for joining us today, and it will indeed be, I'm sure, a pleasure talking to you, interacting with you, and I'm sure there will be a lot of learning points for many of us present over here in this forum who are going to be listening to us.
Thank you, Priyankur, for the kind words.
Thank you, ma'am. Ma'am, so of course, your CV talks for the work that you have done. So of course, a lot of achievements that has already, a lot of work that has gone into it. So, ma'am, looking at the achievements, what made you develop interest in this area of breastfeeding? I think it's an area which is not very talked about, not worked too much about, and of course now people still talk about it. But way back when almost 15, 20 years, I think no one used to even bother much about it. So what made you interested
Was
in it is
about,
something I want
I
to know.
would say, 20 years ago, more than that. I was working abroad, and just from UK, I have shifted to Abu Dhabi. And I had a long theater list, and I had a one CME to attend, and in fact, even talk as a faculty. And I was late, so I rushed and went into the hall. And after 5 minutes, I realized the lecture was going about the breastfeeding. And I saw around, and there were lactation consultants and the pediatrician sitting there. And there was not a single gynecologist around. And the way they were talking about the breastfeeding, and I said, I deliver so many babies, and I just hand over the baby to the pediatrician, and I don't do anything else as a gynecologist. And I think that opened my mind how important the breastfeeding and what I should be doing to help breastfeeding. And then I started attending the lactation clinics there, started holding the baby, how to handle, how to give the mother for the latching. And it was not easy. And then I did the IBCLC as well. That is the International Board Certified Consultant Examination.
Lovely.
Then I came back to India just for the visit. And one of my relative has delivered, and then I saw there was a formula sitting in the corner, and this baby was having the formula regularly. And I asked, and the mother said, I have no milk. And I said, okay. And then I realized a lot of patients, even other in the hospital, same story. I called two of my friends and they said, no, we give formula routinely first few days. That is routine. And then I decided that stage. Anyway, we were planning to come back to India. No, this is my mission now. When I come back to India, I'm going to work for breastfeeding. And this is how my journey started. When
That's
we came back to Pune, people were not ready to listen about the breastfeeding. And they were saying, she has done a FRCOG and what she's talking about the breastfeeding. हमारे hospital में तो आया भाई मौसी भाई, they help the mother. So it started like that. There was a lot of resistance to start with. But I think here, after 17 years of this struggle, I see now so much positivity about the breastfeeding.
That's great. That's great, ma'am, because it definitely is when you talk about it, and now that we have started talking, probably periconceptionally itself, it's something that really helps the mother, psychologically, because we all do understand that breastfeeding is not easy because the stress that the mother has gone through, plus the baby doesn't sleep in the night, she wakes up, she has to feed every 2 hours. It's not easy. But yes, all said and done, we had a program where we said breast milk is the gold, is the liquid gold. And that exactly what it is, and that is what it benefits the baby a lot. So thank you, ma'am. I mean that thought of yours, that conference, I think changed a lot of things, and because of that, you have initiated this Lactagon conference, inspiring a lot of us, and we also look forward to positivity towards breastfeeding for better baby's health.
Great.
So, ma'am, looking at the importance of breastfeeding, why do you think that breastfeeding is more than just nutritional activity?
Yeah, I think the breastfeeding is something the best thing to happen for the baby and for the mother as well. You know, uh, and the benefits are not only to the baby, the benefits are to the mother, to the family, to the community, to the nation, and of course to our environment. So, if coming to the short, the baby mainly when it is born, baby has no its own immunity and suddenly exposed to so many bacteria around. And if you see the initial, the colostrum, it gives a lot of immunity to the baby. It has a rich antibodies. So that is the major. It is also called as a first vaccination even for the baby. And then it increases the baby's brain growth. The IQ of those breastfed babies is higher than the non-breastfed babies. So if you tell this benefit to the mother, which mother doesn't want the baby to perform better in the school? And these babies definitely do better in the school, colleges, better education, better jobs. And so many small benefits, but again, the non-communicable diseases, when the baby grows old, the baby has a less risk of diabetes, less obesity, less heart problems. And, in the Hindi movie, when we take the antenatal class, we just give this example. Like this hero comes, and tells the villain, Agar maa ka doodh piya hai to samne aa. Means what? I am strong because I got my mother's milk. So if you had your breastfeeding, you also come forward and fight with me. So,
Absolutely.
it is that important. The baby's whole life is made. For mother, the breast cancer has become now so common, particularly at the young age. So the mother gets protection from the breast cancer, ovarian cancer, uterine cancer, cervical cancer, and even in her, she gets protected from metabolic diseases, the diabetes and heart problems and obesity. The weight loss, superb, for 6 months when she's producing 800 to 1 liter milk of a liter of milk, she burns at least 500 calories per day. So if she eats sensible diet, it helps her to lose weight. Again, even there is a more reshuffling, remodeling of the bones, and her bones, in fact, become stronger. So
Absolutely.
40 or menopause, they get fractures and all, even that risk or getting osteoporosis is less. And of course, it is free. And sometimes, I say when things are free, it has no value. So that is
Agreed.
what it happens. So again, the family, it is superb. Nation, it is superb. Now, environment. If you see, like it is a organic food, like, it doesn't need any industry. So formula, to make 1 liter of formula, it produces 11 to 14 this carbon prints, and it utilizes more than 5,000 liters of water, just 1 kg of the formula. And all over the world per year, 4 million tons of formula being fed to the baby. So you can imagine that how hazardous it is to the environment. So that is about the breastfeeding. So if you invest 1 rupee in helping breastfeeding mother, you will get 35 rupees. So there is no better investment than this in the world.
Absolutely, there is not, ma'am, for sure, because it is definitely because it was when we were doing our post graduation, it was a simple dictum: breastfeeding is the only way out, and there's nothing else that that is given. But now, unfortunately, I see as soon as I I've done a cesarean, handed over the baby, and when I go for rounds in the evening, there's already a dabba, as you said, sitting there. And then you explain to them and they are like, no, it has all nutrients, which makes no sense, because if something is given free of cost, but again, as you said, when something is free, it has no value. So that is exactly what it is. Because in the I worked a lot, ma'am, towards preserving the uterus. There were a lot of programs that I've done across the country on prevention of unnecessary hysterectomies.
Oh,
So
wonderful.
yeah, so preserve the uterus was the name of the program that we had done. And in the state of Punjab, they had introduced, from the government of Punjab, they had introduced free usage of LNG IUS for the patients over there who required it.
Okay.
The incidence of removal of the LNG was almost 70 to 75% within the first 6 months. So that goes on to say that when a patient spends some money from the pocket, she would have probably thought twice before getting it removed. But when
Yes,
it's free, she thinks doesn't matter. I'll get it removed, and if it's required, I'll get it put back again. So that is the whole problem that we are definitely facing now.
good example.
Yes. So, ma'am, of course, there are a lot of bodies across like Foxy. There are, of course, the world bodies like WHO, UNICEF, etc. So, what do you like? You have worked with them as well. So, and you have worked in the UK as well. So, what was the recommendation regarding breastfeeding from most of these organizations?
That's a very important point to discuss. Because when we ask even the doctors how long to give breastfeed, they have no answer. Or sometimes they say, oh yeah, once baby starts eating after 9 months, 10 months, the mother has to stop breastfeeding. So the WHO and UNICEF, they have 4 recommendations. The first is as soon as baby is born, there has to be skin to skin contact between mother and baby. Provided the baby is all right, and
Yes.
95% of the babies are okay. And so that the baby initiates the breastfeeding within 1 hour after birth. The second recommendation is exclusive breastfeeding for first 6 months. Exclusive means nothing else, means no honey, no glucose water, no formula, no, I mean, I have seen even the baby getting tea and coffee even, in the first few weeks of their life. So nothing else, only mother's milk. And after 6 months, then along with the breastfeeding, because only breast milk is not enough for that growing baby, then we start the complementary feeding, that is Purak Ahar. And that
Okay.
has to be homemade, adequate quantity, soft, hygienically prepared, enough quantity, So, but the breastfeeding should continue minimum of 2 years. So that minimum is the underline, and the maximum as long as the baby and the mother wants. There is no limit, but our anthropological studies said our 1,000 years ago, probably, the mothers has breastfed the baby 4 to 7 years.
Okay.
Oh, but minimum 2 years, that is the recommendation.
Lovely. So I think that sends across a very important point. 6 months, definitely exclusive, and at least for 2 years is something that we are looking at for
Correct.
breastfeeding. And now
Correct.
that we were talking of recommendations, so ma'am, initiating breastfeeding, we know within the first 1 hour, as you said, is very, very important. We
Correct.
know that the mother is tired, the staffs probably are, busy in the OT, in the post-op, recovery room, etc. So why do you think it is important to initiate this breastfeeding within the first 1 hour?
Yes. If you see the baby, the newborn baby, it goes through some stages. But then after few minutes, the baby is wide awake. If you see the newborn baby looking around, and then they have a reflexes, and they have a very strong sucking reflex. And they start even putting the fingers into the mouth, or they do the rooting reflexes, and looking for the breast. And such baby, if we put on the mother's tummy, actually that baby has the reflexes, and that baby can kick on the mother's tummy and can reach the breast. That is called the breast crawl. Of course, we have to support the baby, otherwise the baby may fall down. But what I mean to say, and that baby, if we put within 1 hour, the chances that the latching difficulties will be less later on, and also the lactogenesis too will start earlier, because initially few days, 48 hours, it is the colostrum, which is small in amount, but then mother starts producing the copious milk. So that is why it is important within 1 hour. And so baby doesn't get any other infection. Baby keeps the warmth, from the mother. And even the mother, will have lot of oxytocin, and then
Correct.
the uterus will contract, and then she will have a less risk of having postpartum hemorrhage. So it
Absolutely.
looks very simple, starting the breastfeeding within hour. What is that? Baby is born and we put the baby to the breast, but it is not happening, because we want to do so many things, like weighing of the baby. Then we do the suctioning, like when we go to the dentist, do we like that they putting the suction tube in the mouth? We don't. And that baby 9 months so cozy inside, and she comes up born, and then we do so many insults to this baby, and then in that somebody has to do the suturing, cleaning. So the baby is then gone to the room, mother is still in the recovery or under observation, and somebody goes and makes nice 30 ml some formula or the cow's milk and feeds the baby. This is what happens.
Correct, which shouldn't, of course, and that's what I think we are talking of the shoulds, but the shouldn'ts are more. So we have to probably change our way of doing things, and that would be required. Now, ma'am, of course, breastfeeding is natural. We all know. We all agree to the fact that it is very, very good. But then why are the rates so low? And it is across the globe. Why do you think the rates are so low?
Yeah, breastfeeding is natural. But having said that, it is also a acquired skill. You know, anything, suppose if I want to learn the music, it doesn't come naturally. I have to learn that few months or even years. So similarly, the breastfeeding, the mother has to see somebody breastfeeding from the childhood, then also she learns quickly. But if those skills they are taught to her, then the chances that successful breastfeeding goes high. It doesn't happen that mother just puts the baby to the breast and the baby starts suckling. There are so many things, and the support of the mother is very, very important. So the training of the staff who is supporting the mother and the baby, it's having proper education in the breastfeeding. And it is not only the knowledge, the counseling skills and the technical skills they should have.
Absolutely, ma'am. So thank you for giving those important points and recommendations, ma'am. So, ma'am, as we discussed, 1 hour after delivery we should start. Vaginal birth, yes. Cesarean, also the same. Do you feel there is any hurdle, or sometimes it becomes difficult to feed?
Yes. I mean, a cesarean section, obviously, it is more medicalized birth. It happens in the operation theater. And there are, the anesthetists, the operating team, the nurses, and the baby is separated from mother. But instead of that, even, once the baby is delivered, the cesarean section is still going on. So we can give the baby from the shoulder of the mother, basically, and put to the breast. So that is how it can happen. The skin to skin contact. And because the baby's suckling is stronger, the baby will suckle at that stage. So here I have the baby. Say hello to Priyankur. And this is how, like, mother is lying down. So above the shoulder, somebody holds the baby, and then the breastfeeding can happen. So even after cesarean section, um, because myself I'm an obstetrician, and we do so many cesarean section. But we have to train everybody, for this, and then it happens.
Great. Important point said, ma'am. So it's an important another learning point that we had from you today. So, ma'am, of course, the initial phase, I think all of us in our practice face this challenge where the patient comes and tells us, doctor, the breast milk is not adequate. What should I do? So what is your, solution to it? Breast milk is not adequate. How do we counsel, and what do we tell them to do?
Yes, this is again a very important issue, and that is the main reason, because the mother doesn't have the milk or not having enough milk, we give the formula. So the colostrum is always small in amount. See, the nature, whatever the nature makes, is always perfect. So there are reasons why the colostrum is in small in amount. So it is maybe few drops, maybe half ml, maybe just one spoonful. But baby's stomach is also very small. So that small amount is enough. Baby's stomach is like 7 to 14 ml. So this is the size of the marble, like the children, they play the marble. It is only that much. So that small amount of colostrum is enough for baby. But if you take the caloric requirement of the baby, 3 kg, suppose the baby generally, will require 150 calories per kg. So 450 calories are not made just by that 30 or 40 ml of colostrum in 24 hours. So if you see the baby, we always say ki baby when born, with the baby, she has bought the khane ka dibba, means the baby has a lot of glycogen storage in the liver, and then there is a glycogenolysis happen. The more baby suckles at the breast, the glycogen is converted into glucose, and the baby's blood glucose are maintained. So of course we are talking here about the term babies and not about the preterm babies. So if the baby, and we should not just press the nipple. Many times the nurse or even the relatives just press the nipple, mother's nipple, and say, no, you don't have the milk. So that should not be done. Let the baby suckle at the breast, and the baby latches beautifully, and baby's sugars will be maintained. And even the international body says for term babies, if baby suckling regularly, we don't have to measure even the glucose levels of that baby. So even if the milk is small amount, I think you just keep suckling, and the lactogenesis too by 72 hours will happen. If the baby doesn't put to the breast and there is no activity at the breast first few days, then there is a delayed lactogenesis too, or there may be inappropriate lactogenesis.
Great. It's an important point, ma'am. I think we all understand that, of course, we need to initiate. So how fast is something that we are definitely looking at, ma'am. Ma'am, the second problem is about the latching difficulties. We do all understand that, periconceptional counseling helps, but of course, it doesn't happen all the time. So when a patient comes and tells that they have latching difficulties, what do we do and what should be the solution?
Yeah, I mean, this is again the very big topic to discuss. And when we take workshops, 4 to 6 hours just to tell the theoretical knowledge is not enough, you know. So, I mean, that again, I keep saying, once the staff is trained in that, and if the baby is put to the breast within 1 hour after birth, there are less likely chance that there will be latching difficulties. And but if the baby is given something artificially and directly by spoon, or sometimes even the bottle is given, then what happens, the baby's imprinting happens, that baby is going to get the milk ready made like that. Now I just give one example, Priyankur. Suppose you are given the car and the driver. For 1 week you go in this AC car to your work, and after 1 week, if I say no, from today onwards, you will go on the bicycle. Then you say, no, I want my car back. So similar happens, when the baby is given ready-made milk, and then we try to put the baby latch. Of course, suckling the baby has to work hard, and the baby is not prepared, and plus the flow, there is no ready-made fast flow, so baby is not getting anything, so the baby refuses more. Again we give the formula. With the formula we give full 30 ml, so mother baby's stomach gets stretched, and it is very difficult to digest, so baby goes to sleep, long stretch. So everybody thinks, abhi baby soya hai, means my milk is not enough, so the baby needs formula. And again less suckling at the breast, and really the mother's milk is less, so that is the vicious cycle. Another thing about the latching, if I say, now when we are drinking the water, I'm just giving one example. When now this is the glass of water, I don't drink, it is not flexed, my neck is extended, when I'm drinking the milk. Similarly, the baby's neck also needs to be extended. Now, normally what happens, the mother holds the baby at the head and presses. So by pressing, it is flexed and the baby cannot suckle. So baby tries to throw off, and then the latch becomes loose. So we have to teach that the baby's neck is the weakest part. And that is where initially we have to support and never press the baby's head. This is just the one point. Another thing, our typical mothers, they hold the baby like that and they turn the baby's head. It is as if we are drinking the water like that. So it has to be baby in the same axis and the baby completely turned towards the mother. These are the small tips. If that mother is sitting comfortably, her shoulders are rested, and even her legs are rested and not just hanging from the chair. So if we help all that, surely, she will breastfeed comfortably. But again, as I said, the we giving the time, and the, putting the baby for latching can be time consuming, because baby may be sleepy, baby may be crying, mother may be tired, mother may be in pain, lot of things can happen. So hospitals should have enough staff to give the time for that, and it is 24 hours in the hospital, not just one visit, because mother may need help again and again till she develops the confidence.
Absolutely. Wonderfully said, ma'am. I think that is important because it has to be made a practice and not, wrong practice and wrong habits, and that usually ruins the whole thing. So
Yes.
excellently said, ma'am. Ma'am, we have a lot of current challenges that we go through, but what, according to you, is the biggest threat for successful breastfeeding, especially in the urban population?
As I said earlier, the formula again is the biggest threat, because mothers, I go to the colleges also and I show two pictures. One is the mother breastfeeding and other one is mother feeding the baby by bottle. And when I ask which of this feeding you see in the community, more than 90% of the girls, they said we have seen bottle feeding, we haven't seen the breastfeeding. Even there was a Facebook survey, okay, how many mothers ever saw mother breastfeeding at somebody else? And 50% of the mothers said no, we haven't seen, not even as a child or not in the movie or anywhere, like we see the bottle regularly. So that formula advertisement, again, formula advertisement in the media is so strong. They say this formula is equal to mother's milk.
Mm.
So mother think it is okay, or it gives better growth for the baby. These kinds of advertisements, or they have a nice healthy baby's picture on that tin. So, that then misguides the mother. And also they, in the hospitals also, they give the free samples. The hospital at discharge gives the free samples to the mother. So mother thinks, okay, it is normal. And believe me, sometimes just starting one formula can put the mother's confidence down, and that baby within few weeks will be completely on the formula. So that is why we have this law now in India, IMS Act, Infant
Mhm.
Milk Substitute Act, and that prevents those advertisements like that. And
Yeah.
we should not take any gifts from those companies. We should not have any sponsorship. Typically breastfeeding week, they come and they said, Madam, we want to do breastfeeding activity. Now, why should they do the breastfeeding activity?
Exactly.
Are
Exactly.
they there for our baby's health, or they are a business people? So
Absolutely.
what?
Important point said, ma'am, because I think, as you said, I think that's what. So basically, the tins that we, so easily supplemented are, of course, the biggest threat to the breastfeeding that was so important. And we talk of health, we talk of the health of everyone now in the young population. Also, there are so many cardiac diseases, myocardial infarctions, etc., happening. But during the previous generation, when our grandmothers used to feed their babies only by breast milk, we do not see that many number of people who are instantly dying of these heart ailments, respiratory problems, etc., etc. So we all talk about neonatal onset of adult disease. So I think this could be another thing where, without giving breastfeeding, we are predisposing these babies who in the adulthood will get probably cardiac problems, bronchial asthma, etc. Are quite a few proven things that we already know about. Now, ma'am, coming to your personal experience, I have heard and I've read also about it, about induction of lactation in 148 women which you have done in women who were non-pregnant. What was your experience, and what was your, you know, how did you think about it? That this could be something that could benefit, or this could be an experiment that could help.
Yeah, I mean, induction of the lactation is uh, inducing the lactation in the mother who is not pregnant or who has not delivered the baby. So sometimes she gets the baby via surrogacy or via adoption. So if we prepare this mother, what physiological happens in the mother, during pregnancy, there is a estrogen, progesterone, prolactin, those hormones, and there is a breast preparation happens for 9 months. The ducts, they proliferate, then alveoli proliferate, all those things. And then after delivery, there is a placenta comes out and there is a progesterone withdrawal. And then the lactogenesis too happens. So we kind of similar protocol we make. So there is a one lady called Leonard in Canada. So she had induction of the lactation for the adopted baby. And she breastfed that baby for 3 years. And she learned so much about the lactation in this. So she decided to take lactation as her career. And she has
Oh,
even written the book also now in the lactation, because she said the satisfaction I got. And because, there is no connection, the baby is not grown in your uterus. And so there is a close connection. And of course, all the benefits of the breastfeeding they get, and the mother also gets the benefits. So we start pumping even the few weeks before the baby's arrival. So by the time the baby is in her hand, she has already started producing the milk, about 25 to 30 ml of milk at a time. And of course, after delivery, we have to support her for the breastfeeding. Many times, even the hospital, they don't know about this. So they still keep bringing the formula. So again, there is a lot of struggle. And many health professionals are also not aware of this. So, normally after the 3 months of this surrogate get mother being pregnant, if they're referred to the lactation consultant to us, then we can start her preparing. So we give the hormones first, then we also give some galactogogues, we do the breast stimulation, all this protocol, and it happens. So I have a twins who has breastfed for 15 months, the
oh,
surrogacy. So it is a pretty good, I mean, it may not be 100% milk output they get, but the mothers, the satisfaction they get is tremendous.
the physical and the emotional bonding is
Very
tremendous.
much,
So,
very much.
absolutely, ma'am. Lovely. Myths, of course, there are a lot of myths in the society. Can you name a few myths
You
which
can tell me
confuses the
one myth,
common woman?
and then we can talk on that.
Ma'am?
You can tell me one myth, and then we can talk on that.
The myths like, the colostrum, especially, people think that is bad milk because it's yellowish in color, etc. So this is something that is quite
Excellent.
common. People even talk about
Excellent.
here when I talk to my patients and I say that's the most important one that you have to give, but they are not sure. So first they want to give some honey, etc. But then that's a myth that I can tell you for now, ma'am.
Because they think, it is a stale, it is lying in the breast for few months and it is not good. So they don't give the colostrum in the beginning. They actually throw it. And we call it as a liquid gold, this colostrum, so important, each drop of colostrum. And it has so many stem cells. And stem cells are the totipotent cells. So the research is still going on. So, but probably they go in baby's body, in all the organs, and development of this brain, of the liver. Maybe because of that, they have a less risk of diabetes, less risk of even asthma or some chronic diseases. They get protection from even certain cancers, they get protection. So that is why the colostrum, and even what happens, the meconium is also passed quickly with the colostrum. And so baby getting risk of jaundice is also less. It is rich in vitamins, rich in proteins. So even if it is in small amount, it is very, very nutritious, very nutritious. I tell you a story. Once we went to Anganwadi in one of the village, and after we finishing the workshop, somebody told just the next door, the lady has it delivered, and you just go and see that lady. So I went, and she was inside delivered, and her mother-in-law was sitting outside, on the bed, what we call as a baths. And, there was a very torn mattress, and she was sitting with the baby. And then she had in the katori the milk, And I said, why you are giving this milk? Yeah, the chick doodh acha nahi hai. And then what she did, she took the cotton, dirty cotton from that torn mattress and dipped into that water, and she put into the baby's mouth. So you can imagine the baby has no colostrum, and on top of that the baby will be getting the infection from all those things. So lot of things happen in the society.
Great.
Another
I'm sorry. I was muted. Sorry, I was muted. Yeah, I didn't notice it, man. Yes. So that's lovely. I mean, that example speaks so much about it. And instead of explaining so much, instead of talking so much, still people sometimes don't understand what is
correct,
actually beneficial.
correct, correct.
So, ma'am, we are coming to an end of the session, but we have two important questions that I want to ask you.
Okay.
Number one, being an obstetrician and gynecologist, what is your uh, number one way of making breastfeed successful, especially in your patients?
This is now very, very important question. Particularly, we are talking on behalf of the Foxy and to the gynecologist. I think we as a gynecologist can do a lot because we have a first contact with this mother. We are looking after this mother for 9 months. So she develops the trust in us and she listens easily to us. And that antenatal period, conducting the antenatal classes on breastfeeding, we have an opportunity. The pediatricians won't have that opportunity. And the antenatal period, why? Because the mother has time, the baby has not delivered yet, and we ask even the father and the family members to bring along. So once we tell even the benefits, she's motivated. Yes, breastfeeding is so important. We tell recommendations, then she has a lot of information after going home where to go if she has a difficulty. Lot of things we have an opportunity to tell her. And again, when we are doing the antenatal ward, suppose some nurse is helping it, but she's not helping properly. At least we can guide. Okay, as a gynecologist, we don't have enough time to sit with her for latching and all. But I think we should have the basic knowledge. We can change the policies of the hospital. We can do the hospital baby friendly. We can train the junior residents. We can do certain research. And if some gynecologists more interested, they can do even this IBCLC, the specialized degree. They can have a breastfeeding clinic. And there are so many challenges in the breastfeeding. Just one example is the breast abscess. As soon as we gynecologists see breast abscess, we refer immediately to the surgeon. You know, but surgeon, what they do incision and drainage, and they do the dressing completely on the breast, that there is no question of the breastfeeding. And many times then we suppress even the lactation. So instead of that, now we don't do IND. We just do the aspiration of this breast abscess. I do just in my clinic under local anesthesia. Sometimes we may have to do multiple times, alternate day, 2, 3 times, because it is multiloculated and it may not be possible. But we have a very good, I think I have done more than 200 cases now in my clinic because it is a referral center, and only 2 cases ended up with incision and drainage, all beautifully successfully. So, we can, if and we can give the consistent support to the mother, and it's very, very important. Another thing, it is useful to your family also, no? When your own children, grandchildren
Correct.
are born, you can help. Now, my 2 grandchildren are born in UK. Now, one is 18 months and 20 months. And I thought that was the biggest advantage. Me being lactation consultant, help their mothers and them, and they could breastfeed successfully. So, gynecologists, yes, big role. And I'm happy now, even our Lactacon conference, many gynecologists coming, and then they say, ma'am, we have started skin to skin contact, and we have started initiating the breastfeeding within 1 hour. And I get very happy, listening to that. The changes are happening. And if Foxy takes forward, I think we can do more, conduct even this IBCLC courses for the gynecologist, or we can do the program to make the hospitals baby friendly. The baby friendly hospital certification definitely increases the success of the breastfeeding, because the UNICEF and WHO has put 10 steps And if the hospital adopts those 10 steps, the chances that the breastfeeding will be successful. So I think Foxy can take those 2 steps forward.
Lovely, lovely, ma'am. Wonderful. So, ma'am, you talked about the junior residents and the other residents who work in the ward. So, what are your message for them so that they get empowered, so that they can help this woman in breastfeeding?
Again, the juniors, they are very receptive. We say something and they change. I find sometimes the seniors, they have a fixed ideas and difficult, but juniors, yes. So they should have a structural training about the breastfeeding, and they should have a compulsory some questions on in the vivas, questions on the breastfeeding. So they will learn. They should attend the lactation clinic, can do the round with the lactation consultants or even the gynecologists who are trained in this, and the participation in the BFHI program. And I'm sure, another thing, they should have themselves, when they have a baby, they should get the enough leave. Yeah, because now the government allows 6 months, and other residents, few weeks sometimes we get the leave and we have to run back to work. So we
Correct.
ourselves uh, cannot, breastfeed our own baby. So we have to help them with this aspect also.
Absolutely, ma'am. Wonderfully said. So, ma'am, we'll come to the last question of the day. It was a wonderful discussion that we had with you today. So, your key message to all the obstetricians on this World Breastfeeding Awareness Month.
Yes. I mean, what can I say? That breastfeeding is the smartest investment, and we, as a gynecologist, we are the key people, and we are the first influencer, of this mother and the baby. So we should have enough training. Without training, because I have seen gynecologists saying, you feed breastfeeding 10 minutes on right side, 10 minutes on left side, and they just walk out. So just telling is not enough. We have to do proper counseling, and we make sure that enough help is needed. And that is why this year's, even this Ghosh Vakya for this breastfeeding week, the theme is prioritize breastfeeding, and mother needs sustainable support at all levels. So the hospital is a primary focal point, and I think it is our responsibility to support the mother, encourage the mother for breastfeeding.
Absolutely. Wonderfully said, ma'am. So I think we all are in this mission towards promoting breastfeeding. We all are in this, with you, rather, in this initiative that you have taken in promoting breastfeeding. And I'm sure that next week, as Ashwini was saying, is the Lactagon conference, and many more people are going to get inspired, learn, come back, and practice successful breastfeeding in in their clinics as well. So thank you, Mangala ma'am, for sharing this powerful insights. For all our listeners, I'm sure we need to recommit again to protect breastfeeding as an OBGYN responsibility and a public health priority. So happy World Breastfeeding Week. I'm sure all of you got aware today, learned a lot from ma'am, and I'm sure we're going to practice and we're going to empower our women, counseling them probably antenatally itself so that they can have better breastfeeding, which will benefit the children later on. Thank you, ma'am, once more. It was lovely talking to you, and it was lovely learning from you with all the insights and examples that you just gave us.
Thank you so much. Thank you.
Pleasure, ma'am. Thank you so much.